About all of the hype and the clickbait and the lies out there on the internet and the TikTokers and the YouTubers and the articles you see on Google News and all this kind of stuff. So we're going to talk about that and the dangers of all of it because there are some dangers out there, false hopes, misinformation. There's so many repercussions because of all that false information out there. And as you can see, I was having a little bit of fun with the thumbnail for my YouTube and all that today, and the free ice cream and unicorns. It's so frustrating that I kind of throw my hands up sometime, and I get rather than getting angry at some of the stuff out there, I figured, okay, I'm going to have a little bit of fun. So yeah, there is no free ice cream or unicorns coming. A lot of the stuff you see out there on the internet is not accurate. It's all fun and games. It's all fun and games, like lawn darts, until your next door neighbor kid gets a flying projectile in the head. So I don't know if you all remember lawn darts, but what were they thinking? Anyway, yeah. So let's talk about this, and I'm going to give you some examples of yeah, that, save you some time, some aggravation, and possibly more. I watch out for all of these, articles and videos out there and all these proposals. And if there's anything serious out there, I bring it to you in this channel and other places. So make sure you subscribe and all that kind of good stuff. And that way you can keep up to date so you can learn exactly what's coming down the pike and if there's any other money or benefits out there for you. And based on my decades of inside experience at Social Security, running the third busiest office in the country, I always it's okay. Here's what they announced, politicians, here's what was signed by the president, but how can you make it work for you? And that's what I do. I bring my experience to the table. All right. So, one of the things that I see quite often is people announcing articles and videos saying, okay, checks are coming next month, congressional action. The Congress has demanded the Department of Treasury send out checks to everybody starting next month. And they're going to be, $3,822 or $4,000 or whatever the case may be. And you click on the article, you watch the video, and you turn out it's just a regular monthly check. And yes, Congress dictates that the Department of Treasury send out the check. It's been like that since 1935. Nothing is new. It's just 100% clickbait, and they get you there. And when you click on the article, one of the problems is why it's dangerous is that you also have to, you read the article and it says, oh, Congress has ordered, it sounds very official and everything, average of $3,822 check, and mandates the Department of Treasury to send out these checks. They've ordered the Department of Treasury to send out this check like they have since 1935. And then to read the rest of the article, you have to click on the cookies or something like that. And that's where they get you. John Oliver? Let me show you. Did a really good. This is on YouTube now and different places. Watch this video. He did a good one, a little expose on data brokers. When you turn 65, did you if you haven't turned 65 already, you will, and hopefully, and you'll notice that everybody in the country will send you mail and emails and call you because they want to sign you up for Medicare at 65 years old. And you're like, how did all these people get all my information? Watch that article by John Oliver. These data brokers, every time you click that button, accept cookies or something like that, then they got your number. And they sell that to companies throughout the country, throughout the world, that try to sell you something at some particular time in your life, particularly in terms of Social Security, Medicare. They try to sell you Medicare plans at 65, which you do need, but everybody's trying to get in there first. If you watch a video, basically same type of thing. They give you a great lead. They say, yeah, this money's coming, yada yada yada, and you watch it, and they say this applies to everybody, and you're already invested in this video for like 5 minutes, and then they say, then you find out, oh, it's just a regular check, and you've pretty much just wasted your time, 5 minutes of your time when you could have been doing something important, like watching cat videos or something like that. I've noticed also a lot of with this new AI, Chat GPT, there's tons of articles that are just regurgitated the same stuff by AI, artificial intelligence. So you see a lot of articles by newspapers that I've never heard of before. They're just making up names of some official source. So if you ever type Social Security and you're looking for Social Security or Medicare on the internet in Google, then again, Google's got your information. They know you're interested in Social Security, Medicare. So anything that pops up with those, words in there, they throw you an article. And I found most of the stuff is just completely useless. One of the big ones going on right now is, you've probably already seen this, that there are 2 checks coming this month. And you're like, oh, wow, 2 checks. So you click on the article, you watch the video, and it's just basically because the first of next month falls on a weekend, the Department of Treasury is going to send it out the day before, which is this month. So you're going to get a check the first part of this month, and you're going to get a check essentially the last day of the month. So you're getting 2 checks. You're not getting 13 checks the whole year. You're not getting an extra check this year. It's just that your next month check is coming 1 month early, but you've already clicked on it and accepted the cookies, and or spend 5 minutes invested in the video, and someone's going to make a bunch of money because you watched the video. But that's a waste of time. It's aggravating, but it also has another negative effect. I ran the 3rd busiest office in the country, Social Security office. And when that stuff happens, when there's so-called an extra check or some type of a COLA increase. COLA it's not announced till October. It doesn't come till January. There's a lot of, oh, here could be this or could be that. Nobody knows until October. But all those people, extra checks and extra money and all that, they call Social Security and say, hey, what's going on with my extra check? I heard we're getting an extra check. I heard we're getting this. I heard we're getting this other thing, a stimulus or whatever the case may be. And that wastes precious resources that Social Security Administration just doesn't have. So that's one of the reasons when you call Social Security Administration, there's other reasons as well. But one of the reasons is they've been answering calls all day about a second check this month, and they can't get to you to schedule an appointment or find out what actually happened to your check or get you signed up for Medicare or whatever the case may be, because they're fielding questions from this free ice cream. And as you can see, I was completely frustrated. That's why I came up with the kind of stupid title of free ice cream and unicorns for life. There's no free ice cream and unicorns for life. One of the worst things out there is that really gets people are politicians. Go figure. Politicians are the worst thing out there. And what it is basically politicians. Some politician somewhere in the country. And I always use where I went to high school, Paris, Texas. So some politician, congressional representative, the senator from Texas, wherever the case may be, it's usually just a small little politician, congressional representative, House of Representative, and they're coming up on the election and they're trying to get votes. So they make a proposal that will never pass, but they say they're fighting for their local constituency, and we're going to do this. We're going to give you $200 extra a month, or we're going to give you this, or we're going to give you this other thing, free ice cream and unicorns forever. And it's never going to go anywhere. But that is picked up by the national media. Oh, there's a proposal. I think one is the the one that was it North Dakota, South Dakota, or something. Someone said pay. That they're going to get rid of taxes for Social Security. That's the big one coming up right now. And again, hopefully y'all grew up in the 70s or so. You remember the old Schoolhouse Rock? How a bill becomes a law. It's got to go through a lot of steps. So it has to go through House of Representatives, has to go through Senate, and then has to be signed by the president. So at this very, 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 very first stage, that is just a proposal. It's not going to go in your bank account. So until it goes in your bank account, until the president signs it, it's just hype and clickbait and a waste of your time, frankly. So free groceries. That's another big one out there. Flex cards. This one is actually true, but it's hyped up too much. And luckily, CMS, Medicare, Center for Medicare and Medicaid Services, is clamping down on that nationally. So here's kind of, it's a bait and switch type thing. where they would pick a particular plan, a Medicare plan, in one part of the country that's really, really generous in terms of grocery or a flex card for dental or something like that. And then they would advertise it to the entire country, and everybody in the country would call that company looking for that, awesome benefits. And they say, well, okay, what's your zip code? Oh, well, sorry, it doesn't apply to you. But they already got you, and then they do the hard sell and stuff like that. So it's kind of a bait and switch type thing. And so Center for Medicare and Medicaid Services has finally clamped down on that. So hopefully that will be reduced. I'm sure there's still some bad actors out there that try to do some of that. So please be careful. Again, so if the president hasn't signed it, if it hasn't gone through Senate, then it's not going to happen. It's just some type of proposal. Checks are going out next month. Yes, the checks go out every month. COLA, we don't know, and all the other stuff. Just be careful out there. So I'm going to open up the floor as usual. So we're doing the Q&A. So I'll do a question and answer for about an hour on all things Social Security, retirement, disability, survivor benefits, spouse benefits. If you were just here for the free ice cream and unicorns, then have a great day. Make sure you subscribe. And if you have a question, your friends, family, coworkers have a question on all things Social Security, if you subscribe, that way you can find us again in the future. So click in the chat and let us know if you have any questions, and give me your examples of anything that you've seen out there that you think is suspect, because a lot of people are struggling out there, and they don't need a bunch of BS. They really, really need help. So that's what we're trying to do here. Is in my semi-retirement, I'm trying to help everybody get the benefits and everything they are entitled to. All right, well, let's go ahead and jump into the questions. Everybody, please press like, because when you press like, it goes out to more people, and you're paying it forward, and you just might help someone out that needs help. All right, let's see here. And TikTok as well. Sorry, TikTok, I can't show you all my screens and stuff like that. I need 10,000 subscribers to do y'all right, so please subscribe. Okay, when you apply for SSDI and working self-employed, does SSA, Social Security, use yearly income to be under the SGA work, or do they use monthly income? If you go over 1 or 2 months, does it matter? They use monthly. If you have wages, if you have self-employment, they can average. So I've done this a few thousand times. For people on disability, you can just basically average, because when you're in self-employed, sometimes you don't get paid for a month, every 2 months, every 3 months, or you get paid once a year, or whatever the case may be. So you just ask, if the claim specialist says you're going to be over for this month, then you just tell them, okay, well, here's the deal. I've been working for 6 months, and I got a lump sum for that whole 6 months, but it's actually for a 6-month work. Then just ask them, because of the nature of your work, please average it over the year, and they should be able to do that, no problem. So Greg, if you were my drill sergeant, you'd probably be making me do push-ups daily over my poor grammar and spelling. Yeah, I was a sergeant, but not a drill sergeant. So yes, hello to all my Marine Corps drill sergeants out there, Staff Sergeant Lone and Alvarez and all the rest of it. Yeah, Staff Sergeant Lone. Wow, what a guy. Cloud Guy, hi, Dr. Weir, great info. How can you verify if the special extra earnings for military service credits have been added to your Social Security benefit calculations? All right, good question. So if number one, thank you for your service. And so you are talking about, let me go and pop it up right here. So from 1957 through 2001, a lot of people, again, more clickbait. They say, hey, you're getting $300 more a month and stuff like that if you serve in the military this time. No, they give you $300 extra per quarter for earnings during those years. So if you made $10,000, then now you've made $10,300, and so it's not a big increase, but hey, it's your money, so get it. Yeah, the quickest way, the easiest way is to call the 800 number, 800-772-1213, and just tell them, ask them, hey, did you include my military service? And yep, they'll be able to help you out. Not this 800 number. That's my 800 number if you need help with, Medicare and all that kind of good stuff. So yeah, well, I have a network of partners throughout the country that can help you with Medicare supplements and Medicare Advantage and dental and vision and burial insurance and stuff like that. Because I've seen so many people do it wrong. I figured I'd put together my own team, and full disclosure, they support our channel when you use them. So it's a win-win-win situation. Yeah. So just call 800 number and say, hey, did you include my military time? And if they didn't, you just provide your DD-214 and they will add that in there. No one wants to pay into FICA, but it's a lifesaver in later years. Yeah, yeah. Again, I've taken hundreds of thousands of retirement claims, and a lot of people that were self-employed, they tried to avoid FICA throughout their life, and then when they came in and I told them how much money they're going to get for the rest of their life, and they're like, "Oh my gosh, that's it? How do you expect me to live on that?" I says, "Well, it's based on what you pay into FICA, your high 35 years of earnings. So if you never paid into it, then it's just like any other insurance." So JM, hi Dr. Weir. I'm a Malaysian while my deceased husband is a US citizen. He passed away about 5 weeks ago. Sorry about that. At 67. He started drawing his Social Security benefits at 62. Can I consult with you? Well, if let's see, you're in Malaysia. So if you're in, are you in Malaysia? There is, so you would file for survivor benefits. If you're back in Malaysia, just call the U.S. Embassy in, was it Kuala Lumpur, and tell them you want to file for survivor benefits. And then you have to prove citizenship or green card status, and all the rest of it. And you can go on to the Social Security website. There is what is it called? The Payments Abroad Screening Tool. And because each country has a different, it's called an agreement, a totalization agreement with the U.S. government. So the U.S. government recognizes some Social Security systems and some they don't, and other countries recognize, the United States Social Security system, and they do kind of the agreement back and forth. So they're all completely different. They're all, specific to each country. So probably the best way is to call the U.S. Embassy or consulate. Well, there's an embassy in Kuala Lumpur, so call them up and tell them you want to file a claim for benefits. All right, let's see what kind of TikTok we got going here. Sadly, I was denied my Social Security with a terminal lung disease. Is absurd. Wow, that's with a terminal lung disease. Yeah, I've never heard. I've taken hundreds of thousands of disability claims, but if you've got a terminal, something, unless you're currently working, if you're currently working, they would deny you, because Social Security defines disability as the inability to work. And if you're working, then therefore, according to Social Security, not disabled, unlike the VA. Or you were denied if you didn't pay into Social Security, it didn't have the 10 years of earnings. That means you're not insured. Or the other technical denial would be that you're not currently insured, which basically means that you didn't pay into Social Security 5 out of the last 10 years. So the idea is, if you are insured because you work in your 20s, so you're insured, you're good, but then you don't work for 20 or 30 years, and then say, hey, 30 years later, after not working for 20 years, say, hey, I can't work anymore. And Social Security said, well, actually, you haven't worked in like 20 years. So that could be another technical denial. So if you were denied and none of those applied to you, then 100% request a reconsideration. You can do that within 60, they give you 5 days kind of, mail time, 60, 65 days. But if it's been over that, try it. You just fill out the form. It's SSA 561, a request for reconsideration, and include on there, just write a little piece of paper that says it's a good cause statement is what it's called. You just, the reason you didn't do it within the 60 days, I didn't get the notification, or, I've been sick, I've been going to the hospital. That's why I didn't request this reconsideration in time. So, and then watch my videos. I did 4 videos on disability last month. So watch those videos. And is it mandatory to get a prescription plan if I have a discount at my pharmacy? Very good question. Thank you, Maria Soto. Thank you. Yes. As we used to say in the Marine Corps, nothing is mandatory, but the repercussions are considerable. And same thing with Part B, as in boy, and Part D as in drugs. If you don't sign up when you're supposed to at 65, or you stop working and all that stuff, but if you don't sign up when you're supposed to, then you will get penalized for the rest of your life once you do sign up. So if you never sign up for Part D, then you will never get penalized. But if you eventually do sign up for Part D, once you need some type of drug that your discount thing doesn't provide, then you will be penalized for the rest of your life. And it's 1% of the average premium. So it's basically, this year is like $30 or something. So it's like 1% of that. And multiplied by however many months you did not have your prescription drug plan. So yeah, so if it's been 12 months or 24 months, it's 12% and 24% of that. So yeah, it's and that's your entire life. You will pay that penalty for your entire life. And it does. I would recommend just go ahead and get a prescription drug plan, because there are prescription drug plans out there that are super inexpensive. So there's some out there this year that are like 50 cents and under $1 for the premium. So yeah, I would get it sooner, immediately. But unfortunately, you wouldn't be able to sign up for it unless you just moved or something like that. There's special circumstances, but normally you won't be able to get it and sign up until October, November, December, and then it'll start in January. So, all right, glow smiles. I have Plan G, best ever. Yes, there we go. Yeah, I make no secret about that. I recommend Medicare Supplement Plan N, and then super close behind Plan G. Again, if you're able to, I just did a video on this yesterday on why I would never pick Medicare Advantage. But if Medicare Supplement Premium is not in your budget, then, or in other situations as well, then Medicare Advantage, as long as you keep up on it on a regular basis, when the new plans come on it every year, then it is what it is. So there's, my network of insurance agents throughout the country sign people up for Medicare Advantage every day, because they don't force you to dole out $100, $150 or whatever for Medicare supplement if you ain't got it. If you ain't got it, you ain't got it. So I wish everybody could get a G. I wish the prices would be zero premium or whatever. But watch my video yesterday and you'll get my long diatribe on all my personal opinions, which nobody cares about. But anyway, does Texas have the flex card? Yeah, it's so it's basically goes by your zip code. So yeah, there are places in Texas that have the flex card, and the nomenclature, the name of the flex card, you get different things. So the flex card, the industry really hasn't come up with what does a flex card mean? A flex card, people think it's like the grocery card that you can use for groceries or rent or electricities and stuff like that. But the flex card was actually, it's the reason it's flex is that some of these Medicare Advantage plans, what they do is they say, okay, sign up for our plan and we'll give you $1,000 for dental, let's say. And then you'll have, some vision and some hearing and stuff like that. But we'll also give you an extra $2,000 on this flex card thing. And the flex is you can use that $2,000 to add on to your dental, or $2,000 to add on to your vision, or $2,000 to add on your hearing. So that's the flex part of it that you can, but people kind of have put those things together, and then now they're, grocery cards and, rent and electricity and dental and all kind of things. But super long story short, yes, there are those available in Texas, 100% guaranteed. Whether it's available in your particular area, again, I want to make sure I, don't do the, I'm not a professional football player or comedian or starship captain, and I don't want to give all this incorrect information about there that, hey, you've got, $3,000 of a dental and call us. And yeah, so that's what's been, people have been doing for the last many years. And Medicare has finally said, no, you can't do that. You can't, that's clickbait went out with the 1950s, or excuse me, bait and switch. So yeah, so depends on your area. So find a Medicare insurance agent you know and trust, that is licensed in your state, and get with them. And if you don't have anybody, then email me, call me, leave your name, phone number, the state you live in, and what you need help with, and we can have somebody call you and go over all your options. And that is 100% a free service. What is better, PPO or HMO? Yeah, it really depends. So you're talking to Medicare Advantage, because they have networks. Um, it it really depends. Usually on HMOs, because the insurance company is contracted with the doctors in those networks a little bit more. Usually, the prices of those and the cost savings on those particular plans are better with an HMO. Generally, again, there's thousands of different Medicare Advantage plans throughout the country, and they're all different. But generally, HMOs, if you're able to get one of those, then you get usually better cost savings because the insurance company is negotiated with those. PPO, that means you go to pretty much any doctor that takes Medicare, so the insurance companies have to pay more for those. Um, so you're going to get less, bells and whistles in your plan. For people that, but if you live away from a big city, you probably want to get a PPO because you want a wider network of places you can go. So you'll probably have to sacrifice, possibly, some cost savings. If you live in a big city and the HMO is a big HMO and there's tons of doctors and clinics and and hospitals and stuff in the HMO, then yeah, in big cities, HMOs are usually the way to go, because you've got tons of people in the HMO. But if you're out in the middle of the desert, out in the middle of the country, you've got very limited. So you want to, be able to use a wider area. What is the point of Medicare Advantage? Yeah, to cover Medicare Advantage, Medicare supplements, they cover all of the gaps original Medicare doesn't. Again, watch my video that I did yesterday on this. Get into more detail if you're interested. But yeah, so like for instance, the big one, there's 6 major gaps of original Medicare, original Medicare Part A and then Part B. The A is, free premium. The Part B, you pay every month $174.70. So the big one is Part B only covers 80%. So if you have a $100,000 surgery, you have to pay $20,000 of that out of pocket now. So people get either a Medicare Advantage plan or a Medicare supplement plan to cover all of those gaps. So, and there's no perfect answer for everybody. So it really depends on your particular situation, your health, your age, your budget, your what you think the future holds for you. So it's a completely 100% personal choice. And for all those people out there throwing shade on one or the other, watch my video yesterday. When my husband passed, I lost his veterans pay, his pension. I got a portion of his Social Security. Good. Okay. Yeah. The veterans kind of goes away, doesn't it? Let's see. As a widow, I lost my husband. Okay. Military did not pay for the funeral and did not get a flag. Wow. I'd reach out to the VA about that. Who do I speak to about Medicare? Yeah, email me so this is a TikTok question. So on TikTok, on my little homepagey thing, it's got my phone number and got my email. So call me or email me and say, hey Ed, I saw you on TikTok or wherever. I'm doing simulcast on TikTok and what else? Facebook and YouTube and LinkedIn and Instagram. So we're going out on all channels, 5 by 5. Yeah, say and then give me your name, phone number, your state, and tell me what you're looking for, and I can find someone to take care of you, help you out, give you all your options. And if you don't like any of the options, then it's a beautiful day. Let's see. That's not the way it should be. The survivors should get the retirement benefits and the VA. Yeah, the survivors get retirement benefits, but Yeah, I'm not sure why the VA. Once I get some more subscribers and we start getting, some more support and stuff, I am going to get someone that worked in the VA, in the actual Veterans Administration. I'm going to bring them on, and that way we can expand our help. So y'all can get as much help as you need across the board. Again, I worked with Social Security Administration for a couple of decades, so I know Social Security and Medicare. I worked for the Department of Social Services before that, so I know Medicaid and food stamps and all that kind of stuff. And even though I'm a veteran, I didn't really use veteran type stuff. I used the VA loan and the education stuff, but I'm not an expert in that. So in the future, once we get a little bit bigger here, we'll bring on a VA person, maybe a tax person sometime as well. What age do you apply for Medicare? As I am not 65 yet. Yeah, so it's 65. So about 2 or 3 months before you turn 65, if you don't have health insurance from current work, your work or your spouse's work, then you have to sign up for Medicare. And your employer has to have 20 or more employees as well. Yeah, so about a couple of 3 months before that, then you need to start kicking around your options. If you're already on Social Security, everything is automatic. If you're already receiving Social Security benefits when you're about to turn 65, then Medicare will send you your card automatically in the mail. And at that time, if you're currently working and have health insurance from work, yours or your spouse's, then you just return the card and say, thanks, but no thanks. But if you need it, then you get Part A, Part B. They take the premium out of your Part B premium and they take it out of your check. But then you have to figure out how you're going to cover the gaps, whether you want a Medicare supplement or whether you want a Medicare Advantage, right? You can take neither if you have a few $1,000,000 in the bank that you can, pay your 20% deductible co-insurance. But yeah, almost everybody, Medicare Advantage or Medicare supplement. And watch my videos and reach out and we can find someone in your neck of the woods to help you out with all that. 100% free to you. Let's see. I am in New York and I have a Medicare Advantage plan. I cannot find a dentist that takes this plan. Yeah, again, there's the network thing. But even a Medicare supplement plans don't have dental, vision, or hearing. So you have to find a separate. When you sign up for a Medicare supplement, you sign up for the Medicare supplement to cover the A and B gaps, and then you also have to sign up for a Part D. That's what a lot of Medicare insurance agents out there don't tell you that. You say, well, I got A and I got B and I've signed up for a Medicare supplement plan, but I don't take drugs. I don't need a D. And the insurance agents, what they should do is, okay, stop. Let me tell you about the penalties for the rest of your life. But they just lazy and don't do their job. And then 2, 3, 4 years down the road, you get, penalized for not having Part D. So that's one of the reasons I decided I'll just put together my own team so people get the correct information. But yeah, if you cannot find a dentist that takes the plan, then it might be time to switch your plan. And it really depends what type of situation you're in. There's the annual enrollment period, October, November, December, you can change, and that takes effect. Your new plan will take effect January. But if there's like a 5-star plan in your area, you can switch. You can switch now. If you are currently receiving Medicaid, you can switch. If you recently moved, you can switch. There's all kinds of weird ways you can switch. And you're like, well, I don't want, I like my company and it's zero premium and I like my regular doctor. Doesn't matter. Probably in your area, the company that you have with XYZ Medicare Advantage plan that takes that doctor that, has zero premium, there's probably 2 or 3 versions of that plan. That's what a lot of people, oh, no, I like my company. I like my doctor. Okay, well, fine. Let's keep those, but let's get you some more benefits. Let's get you some more cost savings because those plans change every single year. So you're saying, I've had this plan for 2 years. No, you haven't. You've had that plan since January 1st of this year. The plan you signed up for last year, 2 years, 3 years ago is gone. It's been replaced. It gets replaced every year. Medicare Advantage plans get replaced every year. And you might have the same doctor, might have the zero premium, but all the underlying stuff possibly changed. And you don't find out until you find out, until it's too late. And you're like, wait a second, I didn't know I had to pay $500 a day for hospital. When I signed up, it didn't have it. Yeah, that was 2 years ago, but they've changed that. And now you do have to pay $500. So that's why it's important to please, 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 please check your Medicare Advantage plan. I just did a video a few days ago about how to get your money back from Medicare. And that's one of the ways you get your money back from Medicare, because all this money is yours. You know, that zero premium is not zero premium. You paid for that. When you paid FICA for those decades, that's where that money comes from. So get your money back. So maybe it's time for you in New York to check to see if you can find another plan, or at the very least, I've got a link that you can sign up a dental insurance company that I like. There's a link in the YouTube description. We appreciate you. Thank you all for your time and information. You're welcome. You're welcome. I turned 65 last month. Is it too late to get Part D without penalty? No, no, you should be good. Yeah, absolutely. If you've already if you signed up for a Medicare Advantage plan, most of those Medicare Advantage plans already have Part D bundled in them. So if you have a Medicare Advantage plan, call that plan and say, hey, I just want to make sure, you know, Part D is in there. And if it's in there, you're good. If you have a Medicare supplement plan, also called a Medigap plan, then yeah, you had to sign up for Part D separately. But if you just turned 65 last month, then you're good. Yep. So yeah, if you need help, just reach out to us and we can find someone to help you out. All right, let's see here. Okay, a lot of questions here. Let me go through. Okay, I already got that one. Just wondering if the money you're allowed to make on top of Social Security is gross or adjusted income for taxes. For taxes, I can't, and again, I'm not a tax person, but for Social Security, maybe you're talking about Social Security. So is this a question about the early retirement, the limits you can make in early retirement, that $22,320? It's your gross wages for the year. So if you have deductions for a 401k or, you know, health insurance or something like that, then yeah, it's your gross wages, what your actually gross wages were for this year. And if it's over $22,320 and you're receiving early retirement, then yeah, they're gonna withhold $1 for every $2 you go over. Just Jeff, YouTube has many creators that claim fake content, more stimulus, higher SSI, yada, yada, yada. Shouldn't be able to post the fake content. Everybody needs to stop any clicking of those videos. Yeah, I agree. Yeah, there's one guy out there, that's all he does, the same videos every single day. And it's you know, $200 extra next month. And this is good for all Social Security, whether you're getting Social Security, disability, survivor benefits, $200 extra month. And then 5 minutes into it, it says, if this proposal that some politician in Texas 10 years ago had passed, you would have received $200. I'm literally, this is a video. Yeah, if you know, if if frogs could fly, you'll receive 200. Yeah, so it's that was literally a video. Well, again, I have to watch these. I endure these videos for y'all. All right, so Anna, my husband, yeah, I get so angry. I just have to channel my anger into laughter and put stupid, you know, ice cream and unicorns up there because I get so mad. So, all right, so my husband's Social Security benefits start this month. Does the monthly earnings cap start in May? Good question. Yes, awesome. Thank you, thank you. All right, so I did a graphic. So all the people that have been watching me for a while said, wow, Ed is starting to get good at this YouTube stuff. Not great, but anyway, I mess up all the time. Okay, so yes, good question. So if this is the first year when you first sign up for Social Security benefits, you don't have to do the annual test. You can do the monthly test. So in this example, sorry, TikTok, I can't show you the example until I get 10,000 subscribers. But so in this example, for the first 6 months, this person made $6,000 a month. So the total earnings for him or her was $45,000, right? But the first month you go under $1,860. So this is the first year only. It's only 1 year. The first year you start collecting your Social Security benefits. The first month this year, 2024, the first month you go under $1,860 and you stay under that monthly limit for the rest of the year, then you're good and nothing will be withheld. So even though this person made $45,000 the entire year, doesn't matter. You can make $1 million up until, let's say, this month. But as long as when you start your benefits, if you start your benefits, this month or next month, the first month you go and stay under the $1,860, you're good. Nothing will be withheld. But the Social Security system is not the smartest system in the world. And it really depends how the claim specialist that puts your husband's claim into the system. It's called MCS. And there is a particular screen. I've done this a million times. It's non-service months. And if they didn't put the X in the correct place, which a lot of employees mess up, then what happens is next year he's going to get a bill that says, hey, you worked over the annual earnings limit. You owe us, $2,000, $10,000, $1 million, or whatever the case may be. And it's easy to fix. You just go down and say, hey, when I started receiving my monthly benefits, I stayed under the 1860. So before that, I made a whole bunch of money, but once I started benefits, I was under 1860, and they'll correct it and delete out the overpayment. It's easy. And hopefully they go to that employee and teach them how to code that correctly. So yeah, nobody in my office coded it incorrectly. They all did a good job. Now I'm sure. Anyway, let's see here. What else? Anna, what's up, Anna? In applying for his benefits, if it asks if he's also applying for Medicare, which he will be, does Social Security process the application on their end, or would it need to apply separately? No, you can. When you file for regular retirement benefits, you can do, add Medicare in there as well, or not. And a lot of people get penalized for Medicare because they say, well, I don't want my money to start, so I'm not going to start my Medicare until I'm 67, and they don't have health insurance, and they get penalized for the rest of their life. So when you file a retirement application, you can say yes to Medicare, let's start Medicare at the same time, or no, because you already have health insurance. And the opposite as well. If you want to wait to collect your retirement benefits, so it increases, you get the extra the increase based on your full retirement age or delayed retirement or credits or whatever, and you just want to sign up for Medicare, you can do that, no problem. I just want to sign up for Medicare. I don't want my money. I just want to sign up for Medicare Part A. I don't want B or my money. You can do that. I just want to sign up for Part A and Part B, but I don't want my money. You can do all of those versions. Easy, 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 easy. Can you explain what happens to the dollars that is earned over the limits for those that continue to work Social Security? Yes. Good question. Y'all are kicking it today. I like it. All right. So this is information. Hopefully a lot of y'all press like so more people watch these videos and benefit from y'all's awesome questions. Okay. So basically, if you work, let's do this example. If you file for retirement benefits 30 months early, so your 30 months early is going to get you 30 months reduction in your Social Security benefit, because your full benefit amount is when you hit your full retirement age. So you decided to go ahead and take it 30 months early. Okay. And then after 10 months, you say, I got bored, I want to go back to work. And you go back to work and you're making over the limit. So the Social Security holds back all of those checks. So you get 10 checks, and the next 20 checks you don't get because you earned over your limit. What happens is once you hit your full retirement age, the Social Security computer system is pretty good in this respect. The Social Security computer system looks back at your record and says, okay, you're reduced 30 months, but you only took 10. So it recalculates everything at your full retirement age, and going forward for the rest of your life, you're only reduced by those 10 months you actually got checks. So that money is put back into your monthly benefit amount going forward. So it's not lost. And that's completely automatic. You don't have to worry about anything. Let's see here. Does the military benefit count for Army reserves? Let's see here. I'm almost sure it does not. Um, Special extra earnings credits are granted for periods of active duty or active duty for training. So yeah, so it's active duty for training. So if you went to boot camp or something like that, activated for training, then so yeah, straight regular reserves doesn't look like it. So let's see here. April 79 watching, 54 thumbs up. Please hit the like button. All right. Everybody's always out there looking out for me. You guys are awesome. You guys are too awesome. All right. Don Ricky, I will be on Federal Blue Cross Blue Shield when I turn 65 in October. Can I wait 3 months later to the following year to start Medicare? Um, yes, but you will be penalized because it doesn't sound like it's current work. Is that a retirement plan? If it's current work, you can wait, 3 years. But if it's not based on current work, then you're going to get penalized. And I just talked to somebody yesterday that worked for the VA, and same exact situation, and Blue Cross Blue Shield, and you don't have to sign up for Part A or Part B. I think the post office recently changed that. So if you work for the post office, I think they're making you sign up for Part A and Part B. But most other agencies, so call your agency or OPM and see if they mandate you. But if they don't make you, then you don't have to if you don't want to. The guy I talked to yesterday decided, no, okay, I'm not going to sign up for it. I'm happy with my Blue Cross Blue Shield and all the rest of it. So, why waste the Part B, and my agency doesn't require it. So it's a completely individual decision. So if they're making you, then you have to sign up when you're supposed to, or you'll be penalized. If they don't make you, then, kick it around, you know. Um, so if I'm on SSI and thinking of getting married, he just got on SSDI at age 60. He is disabled also. Will I lose my SSI? Hey, Sherry, how you doing? Yeah, it really depends on his income. So because you're now going to be married, you've got more income coming into the house. And because you're on SSI, so I assume you are actually on, the difference between SSI and SSDI. If you've been watching my, the channel, that, a lot of people don't, but it sounds like you do. So yeah, if you're receiving SSI, it is income or resource based. So if he's bringing extra money into the household and paying part of the rent and all that kind of stuff, then yes, it's probably gonna affect you somehow. It really depends on how much he makes and everything. So once you get married, make sure you reach out to Social Security, because they will eventually find out, and you don't want a nightmare and overpayment in the future. So be really forthcoming and say, hey, I'm getting married, and they'll, if he's receiving SSDI, they'll have all his information. It won't affect his because he's receiving SSDI, unless he's receiving disabled adult child benefits. Then it's a whole different situation. But yeah, reach out. Both of you get on the phone, call. It's gonna affect you. It's probably not gonna affect him, but be on the phone together. It doesn't hurt. My friend's husband died. He didn't have enough credits for Social Security. He was collecting on the basis of his marriage to her. Can she get a widow's pension or any other benefits? So he didn't have enough credits for Social Security. He was collecting on the basis of his marriage to her. Yeah, if he was married to her, a spouse, when she passed away, then if so, if he okay, all right. Here, I got the question. Okay, I got it. So you've got a husband and wife, and one of the spouses passes away, and the other spouse was already receiving benefits on that person's record. That person doesn't have to do anything. It's automatic. This is called in an auto convert, as we used to call it in Social Security. It converts from a spouse benefit to a surviving spouse benefit, widow, widower, whatever, but same thing. Yeah, so it's completely automatic, and you'll even get that. And if the addresses are the same, if they were both living in the same household and everything, they'll even get that awesome lump sum death payment, the $255. So everything will be automatic. You don't have to provide the death certificate or anything like that, because in almost all states, it's automatically recorded. So just have him check his bank account here, and it probably his benefit amount will increase. So it's automatic. And if it doesn't happen within a couple of weeks or so, then reach out to Social Security and just kind of double check and say, hey, what's going on? But usually, 99% of the time, it's auto convert. So, all right, let's see. Agreed, Jeff. I have unsubscribed from all other Social Security Medicare experts. After all, we have America's leading government expert right here to answer questions. Oh, thank you, Lisa. You guys are awesome. All right, y'all. The reason I'm doing this I think I'm at day 23, 24, where I'm doing this every day. A lot of I'm sure I'm turning off a lot of people. A lot of people are unsubscribing. They're like, I'm tired of seeing this guy's mug pop up every day, but I'm trying to build a resource of a whole bunch of videos, a whole bunch of different things, different topics. So even if, so you can watch it. So, meaning, do I have to wait, or would Medicare continue with change over to retirement? Not, so do I have to wait? Would Medicare continue with change over? Yeah, sorry, honey. I'm not, I'm sorry. That's her name, Honey Bee. So I'm not calling her Honey. So yeah, not sure I get the question. So please ask it again and I'll answer it. Hello, Doctor, I have a question about SSI. I am on SSDI and collect $1,144 from SSDI. I want to apply for SSI, but I was told that I collect too much unearned income. That is 100% true. You will not be approved for SSI, because the max you can receive from SSI this year is $943. And you make more than that, so there's a 1-for-1 offset. So basically, you'll receive nothing from SSI. So, but if you're receiving $1,144 a month, and if that's your only other income, I would definitely reach out to Department of Social Services in your state and apply for Medicaid if you haven't applied already, because they should pay for your Medicare Part B if you don't already have it, and get you some other benefits as well. So if that's all you're making, you should definitely be qualified for that. All right, let's see here. Dutch Conrad, thank you, Dr. Weir. You're welcome, welcome. Joyce, can my husband apply for spousal even though he is receiving Social Security? He got it through disability. Yeah, it depends if your benefit amount is twice his. He's 62 years old and all that. And it's the amount is because he's receiving his full benefit amount, because when you receive disability, basically it's as if you waited till your full retirement age. So your benefit amount might not necessarily be the amount you're currently receiving, because if you took it early, it's reduced from your full benefit amount. So it's kind of confusing, but if his full benefit amount at full retirement age is less than half of your full benefit full retirement age, then he could conceivably be entitled to benefits on your record. So the easiest way to check those numbers is to call the 800 number, Social Security 800 number, and say, have him call and say, hey, I want to file a claim for spouse benefits. And they will immediately run the numbers and they'll say, there's no money, or, oh yeah, there's more money in there, and they'll schedule him an appointment. So, Don Ricky, coffee here. Yeah, coffee. Awesome. Thank you. Art, won't the excess number earned while on Social Security change the FRA? Thanks for your time, sir. Yeah. Yes. Yeah. So that's yes. That's the you answered the other person's question, but I got to it first. So yeah, the FRA amount. Yes. Again, it'll be added back in there. I think that's what you're talking about. So you helped me answer the previous question. Thank you. This is a good community here. Thanks for letting me know. Are there any other programs I can apply for? I also have Medicaid and Medicare. Awesome. Good deal. Yeah, there's so many people out there that don't understand the difference between Medicare and Medicaid. And they also don't understand that you can have both, like Catastrophe 1963. Yeah, you can have both. And then if you have Medicare and Medicaid, then you're also eligible for a Medicare Advantage dual plan, which are, yeah, definitely need to check those out. A lot of cost savings, a lot of extra benefits in there. So definitely check those out. All right, let's see what we got. Don Ricky, bought me a coffee and or beer. You are too awesome. Thank you very much. Thank you, thank you, thank you. I sure appreciate it. Let's see. Honeybee. Okay. Okay. The first part was before that. You right listening to the others. Some say Medicare would be gone and then reestablished after waiting. Oh, okay. Okay. So I guess I answered your question, right? Okay, let's see. I only asked because come June 1st, I will be homeless for the first time in my life. I am 60 years old. I tried to apply for Section 8 and every waiting list in Northern Illinois is full. Yeah, that's unfortunately the par for the course for pretty much every Section 8 waiting list in the country. Yeah, we really need to do something about that. There's a Supreme Court case based out of Oregon that, we really have to do something about affordable housing in this country. All right. Catastrophe. Let's see. Okay. So you're 60 years old. All right. Um, so hopefully you're receiving benefits, either disability benefits, SSI, SSDI. And if you're not, because you're 60 years old, were you ever married for 10 years or longer? Or were you married to someone when they passed? Because you're 60, you're eligible to start survivor benefits. So, but only survivor benefits. So if you had ever married anybody, okay, so catastrophes on SSDI, Medicare, and Medicaid. Okay, awesome, awesome. Okay. So that's a good start. And then Medicare Advantage plans, those are, you can add some extra benefits in there. Okay, no, married only 7 years. Okay, all right. So there's no survivor benefits in there. Medicare Advantage might be able to get you some extra benefits, and depends on your area, like a food card or rent. But that's not how it's going to help you now. But let's see. I did 4 videos on living on Social Security alone. Hopefully you watch those 4 videos, and there's 48 different programs in there. So the introduction is a little bit long and boring, but get through that, and then, grab a piece of paper and a pen and watch the videos and say, okay, I can't use that one. I can't use that one. Just check off all 48. And hopefully there's something in there out of those 48 programs that can help you out. So, yeah, the Section 8 housing. Section 8. So when you apply, and you're about to be homeless, recontact Section 8 housing again. Because what they have is, some of the times they keep some listings kind of in their pocket for like an emergencies. And I think yours sounds like an emergency. So contact them again. Say, yes, I understand I'm on the list. I understand, I'm eligible to receive an apartment in year 2100. It's crazy. But here's the situation. I'm about to be homeless next month or 2 months from now. And they might have a pocket listing where okay, well, in that case, then let's go ahead and put you ahead of the list, and, whatever the case may be. So reach out to them again and see what they can do. And then you've got, again, not only Social Security, SSDI and all that, but you also have county. Reach out to the county, reach out to your city, and they all have different resources depending on there. So yeah, I wish we could do more. Let's see here. People need to go to new construction in town or city they live in. That is listed with the city government site that they live in new construction. Let's see, Jen. Yeah, yeah. So I think I was talking about yeah, city. Cities sometimes have benefits and some type of resources. All right, Jan, I'm turning 67 in November, full retirement at 66 and a half, working at a company with over 20 employees. I have insurance there for me and my husband. I plan to keep working. Can I apply for Social Security and not Medicare? 100%. Yes. So you have health insurance from work and you're happy with it, 20 more employees, yada, yada, yada. So you do not have to sign up for Medicare. Once you stop working at 70 or 80 or whatever the case may be, then you sign up for Medicare Part A and B. You can sign up for A now, it's free. If unless you're giving to an HSA. If you're contributing to a health savings account, then you shouldn't sign up for Part A. But if not, you can sign up for Part A. It's free and it covers hospitals and a little bit extra coverage, I guess never hurt. But yeah, once you're 70 or 80 and you stop working, you and your husband stop receiving health insurance from that work, then you go ahead and sign up for Part B. And there's 100% no penalties whatsoever. You just need a couple of forms. It's a 564 and a 40B. Just come back here at that time. I'll still be here. Um, Knock on wood. But yeah, you'll just need a couple of forms. One of those you take down your employer and they confirm that yes, she had health insurance since she was 65, and then you won't get penalized. No problem. Uh, oh, okay, Fem. Here it is. New construction will have a new wait list. That is how you get ahead of the game. This is vital information. I worked in Florida Post industry. Awesome. Yeah. So good. Thank you. Thank you, community. Thank you, Feminim Feminim with a rose or something. Too small there. Sorry. Yes. Okay. Good. Good. Good information. Yeah. Go to new construction and stuff like that, and they might have a new wait list there. So yes, do. All right. First time to your channel, you are awesome, and I'm staying around. Thank you. You're welcome. Thank you. Thank you. Thank you. Hi, do I need to be 62 in order to file for divorce spouse benefits? Yes, unless that person has passed away. You can file for surviving divorced spouse benefits at 60 years old. But if that person is still alive and kicking, then yeah, you have to be 62 to apply. And here's another thing that a lot of people are missing out on. Number one, you have to file for benefits on your own record first. So if you're not insured or something, no big deal. But you have to file on your own first, and then you file for spouse benefits. And there's thousands, tens of thousands, hundreds of thousands of people out there possibly that are not receiving the spouse benefits because they think their ex-spouse needs to have filed for those benefits. And that is not correct. Their ex-spouse just has to be 62 years old. And if they are going to wait till their full retirement age or 70 or whatever, it doesn't matter to you. You don't care. File for benefits on your own record and then file for benefits on that person's record. It's called the independently entitled divorced spouse. This is the government we're talking about. So it has to come up with a nice long name. Independently entitled divorced spouse, because you're independently entitled because you don't care that they haven't filed yet. Your benefit won't be reduced because they haven't filed. It'll be reduced because you're filing early, but you're going to get that money. So yeah, so you don't have to file for benefits, or excuse me, they don't have to have filed for benefits. So catastrophe, I will look into Medicare Advantage. Thanks. I'll watch them all. Thanks very much. You're welcome. You're welcome. Yeah. Take that advice, and definitely. Okay. All right. Here we go. There we go. Homeless can get emergency food stamp SNAP benefits. Yes, absolutely. Hopefully, yeah. She's getting Medicaid. Usually, Medicaid and food stamps are by the same agency in most states. But yes, good reminder. Yes, if you're going to be homeless here soon, reach out to Medicaid and all them and tell them, hey, by the way, this, that, and the other. And yeah, in your state, they might give you some extra food to help out a little bit. Gosh, okay, more. You guys are awesome. 1963 with Medicaid and Medicare, there are DSNP programs with Medicare Advantage that will cost you zero. Yes, that's what I talk about. Yep. All right, we're all on the same page or team here, helping people out. I love it. So yeah, so the Medicare Advantage plans are called dual eligible DSNPs and dual special needs plans acronyms. And they're zero premiums, and they work with Medicare, Medicaid, and yeah. But you said you're in Illinois, right? I think Illinois doesn't have any DSNPs. Um, yeah, yeah, reach out to if you have a Medicare insurance agent you know and trust, reach out to them, or like I said, email me, call me up, and I can find someone to help you out. Diane, I had a 45-minute consult with SSDI. So I had a 45-minute a consultative exam. So consult a CE consultative exam was with she filed for disability, and the Social Security system decided that they want her to see a Social Security doctor. So she had that last week. The Social Security doctor added COPD to my record and filled out symptoms form to my claim. Is that a good sign for my claim, or doesn't mean anything? Yeah, I mean, yeah, it's you know, sometimes disability claims are approved not for your main condition, but other things added to it. You might not have one thing that's a slam dunk approval, but if you add, this plus the side effects of the medication you take for that, plus this other thing, plus this other little thing, and separately they might not get it, but all together they might get it. So absolutely, that just might help out. Sherry, you said you skipped or didn't see my. Okay, all right. So let me see. Yeah, this little thingy that I look at the questions on, it's not very big. So Sherry. Okay, here we go. Okay, Sherry says, I have another question. If my stepdad quick deeds the house to me, I'm on SSI. Would that affect my SSI? Yeah, that's more of a legal thing. And quick deeds, when you're on SSI, any type of income and resources that you have access to will count against you. But if it's a house, you know, he could give you a $2 million house, and if it's your only house, then that is exempt. You don't have to worry about SSI. One house and one car is exempt. But if that's going to be a second house to you, and it depends the kind of legal structure you get it set up on, if that's a resource that you can access, then yeah, Social Security just might hold that against you. All right, some more. Here we go. Get in touch with Continuum of Care. This department at every state can assist with housing vouchers. All right, good information. Thank you. And some more. The city government website will list housing projects that have what is called project-based vouchers. Okay, I'll leave that up here for a second. So the city government website, go into your city government, list the housing projects, and then ones that have project-based vouchers. So we're talking Section 8 vouchers, right? All right. And ARC says, good luck, catastrophe. Awesome. And good. TMZ, I would opt for a voucher instead of a project-based housing. Yeah. All right. Tina, can one purchase a house being on SSDI monthly income for 11 years? Yeah. Then no, that's no problem. If you're on SSDI, that's only for SSI. For SSDI, your resources don't matter. So you can have $1 billion and collect SSDI, and your unearned income doesn't matter either. So you can have $1 billion and get take out $200,000 a year from that, and it doesn't affect your SSDI because that's SSDI. If you work to earn that $1 billion, then it's going to affect you. Jan, thank you so much for your help. You're awesome. Oh, thank you. Diane, no, it was Jan, I'm sorry. And then Diane, thanks you so much for your time and helping all of us work through the complicated Social Security system. You are welcome. And Catastrophe said, thanks everyone for help. Oh man, now I gotta, this is awesome. This is why I'm doing this channel. This is exactly why I'm doing this. I knew y'all were gonna step up to the plate. Yeah, you guys are awesome. Thank you so much. It's my only house. I have lived in it for 20 plus years. Thanks again. No problem. All right. So I'm getting a bit emotional here. So I think I'm going to end it for the day. All right. This is why I do this. Okay. You guys are awesome. All right. I'm going to end it. Y'all have an awesome day. I'll see y'all. I'll see you tomorrow. But if not, y'all have a great week. Take care. And thank you all. Y'all.